Good afternoon, everybody. I'd like to welcome you to this Zoom meeting from Scriber Media Center. Today, we're going to be talking with Karen Barkley and Melissa Howe from the NOSP, which stands for what, Karen?
North of Superior Counseling Programs.
Counseling. Why is there no C in there?
I know. It just wouldn't work. It sounds better when you just say NOSP.
Because I know about NOSH, and that made sense, but I was thinking, what does the P stand for?
Yeah,
okay, great. Welcome, everybody, today. I'd just like if you could just quickly introduce yourselves.
I guess I'll start.
Sure.
So my name is Karen Barkley, and I'm a registered psychotherapist. I have an extensive background in addictions and mental health. And I'm the regional manager for NOSP in Manitowoc, Scriber, Terrace Bay, and Marathon.
Okay. Melissa, you may as well go next.
All right. Hi, I'm Melissa Howe. I'm a family support worker here at NOSP in the Scriber location.
I'm Donna Mikluk. I'm the head librarian in the Scriber Public Library.
And Rona?
Okay, my name is Rona Godden. I'm the chair of the Scriber Library Board, and I'm a member of the Scriber Media Center board.
Wonderful. Well, welcome, everybody. I'm glad you could take the time to come to this meeting. The very first thing I think that we should talk about with everyone is what is mental health? And it's kind of a loaded question, and it's a big question, but a lot of people may ask that. They'll say, well, because later on we're going to find out different things about mental health. But as a general bracket thing, what would you say is mental health?
So when I was pondering that question a little bit, I think it's a little bit like asking what is cancer or what is health, because it's such a broad term. And mental health, of course, isn't really separate from our physical health, because a healthy mind is a healthy body and vice versa, right? So it's integrated in our bodies. They're not actually separate things. So when I think more about, if I was to say what is mental health, I think it's more about optimal conditions, right? So it can spanning the lifespan and all the areas where people normally derive health from. We could talk about more the conditions that create positive mental health or good mental health in people. So that would be, different things at different times, but it's always having the optimal environment to be able to develop, socially, personally, and just like in every way, health-wise, that capacity to optimize who you are and what you do.
Would you say then environment would play a key role in it? I mean, I'm not talking about like a physical form of mental health or anything that would be caused from a non-environmental issue, but would you say that environment would be a very, very large part of that then?
Absolutely. So we know that we're social animals, and the way our neurotransmission, the way we're regulated, very much depends on contact with other human beings. So there's like just the eye-to-eye contact that we're all having right now, even though it's virtual, regulates and changes our neurotransmission. So, and we know that children from conception to about 18 months are setting up that apparatus that's going to help them interact with the world. So mental health, we often think of it as something contained inside our heads, when in fact it really is contained and influenced by our entire environment. And social relationships, positive social relationships are fundamental to anyone's mental health across the lifespan.
So anybody who's like a fairly extroverted type person, I notice that they seem to be struggling the most. I mean, just sitting with themselves and their thoughts seems to be a lot harder than people who are can just, basically live on an island somewhere and not even be around people.
Right. So you're right. I mean, there's so many factors, right, that can make people more or less vulnerable to what's going on, and personality type. If you want to say introvert and extrovert is one, like you're quite right. For some people, some young people, for example, are really used to socializing over the internet, and it's a way that's pretty common to socialize now. So there's not really much disruption to their way of life. But for other people that are more used to getting out and being in contact with other people, the pressures of being at home and not being able to have those normal supports has a greater impact. And then COVID-19 has brought different impacts socially on people based on the resources they have and the abilities they have and what they're being saddled with, right? So there's lots of moms that work and now they're at home and they're trying to school kids, keep the house in order and do their work at the same time. So the pressures on women, it's been noted, have been enormous, right? Well, shocker. And for children too, that aren't able to play with their best buddies, very young children, they have a harder time understanding it. So there's a kind of grief associated with that and a kind of loss. So depending on who you are and where you are and the resources you have, you might be affected differently.
And when you say resources, my immediately thought was, because there's, the chances a lot of people have now become unemployed as well. I was thinking financial resources, but it is much more than that, because even people who may be financially well off are still going to be struggling with the mental issues of the isolation, I imagine.
That's right. So like that's another aspect is finances, and it's not relaxing for everyone to have a bubble bath if there's mold in the bathroom and the apartment's drafty and there's 5 kids running around. So depending on your circumstances, not just financially, but what is your capacity to entertain yourself? What are your resources? Do you have a computer? Do you have the opportunity to get outside? There's so many things that can alter your life, right, under COVID-19 and make it difficult to have contact and to be able to find opportunities to have outlets for your stress.
Let's go to the next topic, and that is, or the next point that I wanted to make is, when discussing mental health, what would be some early warning signs? Now, you've talked about environment a little bit, how that can affect you, but as a person who could be becoming affected with mental health issues, or someone who already has them, how do we tell, like not only as a patient, how we can feel, like what would the signs we could look out for as people? And is there a way that other people might observe someone and be able to say something? Basically, early warning signs, really.
Sure. So I think, again, there's so many different mental health conditions and they really range in severity. And but if we're just talking the average person and talking about stress in the context of COVID-19, some really common indicators that you might be running into trouble is if you find yourself worrying a lot more than usual, if you sleeping more or sleeping less than usual, if you're eating more or eating less than usual, like changes in appetite, if you're more irritable. These are like really typical signs that something's gone awry. And it just usually means that people's normal coping is overwhelmed. And that's where, like, those signs might be an indicator to you to reach out and talk to someone before things get worse. Maybe if you're drinking more than you did before. And I want people to remember that substance use, also, like when it becomes a disorder, also falls under a mental health condition. And it rarely is alone. It's often paired with other mental health concerns. But those are the signs that, those are typical signs that you're under a lot of stress and that maybe your coping mechanisms are being overwhelmed. And that can happen to anyone. It doesn't mean that you're, mentally ill. It means that, you might be a little overwhelmed.
Right. Okay. When do we seek help? When would, once we acknowledge the fact that we might be under strain, under stress, or suffering some kind of symptoms, when is the best time to seek help? And I know most people will say right away, but I'm thinking, you need appointments. You can't just walk into offices and stuff like that.
Yeah. So I think that was something, well, first of all, I want to say that I think sometimes people pay more attention to their cars and care for their cars better than they care for their own mental health, right? So mental health is a really, really important aspect of your overall health. And you can almost think of it as the engine for the rest of your health, right? If your mental health is not good, chances are your physical health won't be that great either. So I really want to encourage people to start thinking of their mental health the same way they think of their precious car, and take it in as soon as you hear a little noise that's not making sense to you, right? And you're a little worried. So come on in, give us a call. It's not hard to get into services like the Canadian government has created Wellness Together for people all over the country to be able to call in. NOSP, the more local services, we've made it very easy for people. Instead of our walk-in clinics, people can just call. They get a very quick response. They can have phone sessions. They can have virtual sessions like we're doing right now. We can connect them to more different levels of care if they need that. So I think that, like anything, the sooner you nip a problem in the bud, the faster you can get back on track with your life. So I would really, really encourage anyone to just call as soon as they have a concern.
One of the things that I didn't actually include in my original list, but you were going right towards it at that point. When you have different, like we're talking about when to seek help, would crisis centers, would that ever be considered a first port of call, or something, what's the word that I'm looking for? And want to acknowledge that you could have a problem, and a lot of people were encouraged in the past, especially, to seek out crisis centers. Could that be a first step towards then going towards more professional help?
So crisis centers are really, well, there's a couple of things. So here in the very rural north, it's not like being in Toronto or Montreal, where there's a lot of different levels of crisis intervention, like mental health teams that will accompany the police to homes, or follow-up care for resolving a crisis, like short-term care. So I think that there is a mental health crisis. There is a mental health crisis line that people can call, but hopefully people are usually calling a counseling or psychotherapy service before it's a crisis. So crisis is really for those extremely urgent, you're feeling suicidal, you're thinking of suicide, and you're really afraid of your thoughts, or you just can't, you're so worried, or someone you know is paranoid or threatening harm to themselves or others. That's a mental health crisis, and it would be important at that time to call 911 or present to a hospital. So they would triage a crisis. But hopefully people, like I've said, will start, and I think people do this, are starting to pick up the signs that things are going a little off track, and maybe all they need is a few sessions with a counselor, a little bit of therapy to help get them back on track. So those services are available, the crisis services, like through the crisis line or the hospitals. And at the same time, we work very closely across the district with the family healthcare team to make sure that people have, both the support of their doctor if they need medications, but best practice for most mental health conditions, and usually we're talking about depression and anxiety for the most part, especially under COVID-19, it's stress responses too. Best practices are to have, in conjunction with any kind of medication, also a bit of therapy or counseling to be able to solve problems and to increase your capacity and your resistance to solving life issues.
Karen, have you found that there's been an increase in the number of people reaching out for help? Do they feel comfortable doing Zoom sessions?
So it really varies across our districts. I'll say a few things about that. When you're talking about children, it's very difficult to engage with children by Zoom and by phone, although it seems like some counselors have more skill with that than others. So it is a bit of a skill on the part of the counselor as well, and not just the client's comfort, but the counselor's comfort doing that. And it's a developmental skill. So we've worked a lot with our counselors to give them resources and materials and guidelines to be able to do that. and they also have communities of practice to increase that skill. But so yes, for some people it's wonderful and it's a great tool, like they prefer calling in or using Zoom because they don't have to park, they don't have to get in their car, and they don't have to find a babysitter, et cetera, right? So it's very convenient for some people. And they can also call, they can be connected with a counselor outside of their hometown, which a lot of people seem to appreciate, right? So even though everything's confidential, I think that people sometimes like to connect with a counselor in a different town. They just feel more comfortable. So it's really made us jump into that virtual world. So we're offering that service. But some people don't have a location to go or the space in their homes to be able to communicate with us virtually that way. So that's been an ongoing issue, and we've tried a lot to troubleshoot in different communities around that issue. And we're working towards reopening. So what we have noticed is that we actually had a drop in phone calls at the beginning of COVID, and it's starting to really uptick as we're moving towards reopening. And we did notice when it was locked down that there was a great increase in people in using substances that they weren't used to using. And so they would become in a kind of crisis with their substance use. So we noticed a great increase in that. Yeah.
Yeah, we're going to come to drugs and alcohol next, or not next, one more thing beforehand. Tying in with when to seek help, it seems that there still is a lot of stigma associated with, and especially negative feelings towards people either admitting they have problems, talking to others about problems, and it still seems to be something that's hidden away and not too talked about. How is it, or what are some of the tips or ideas that you might have about how people can overcome the stigma and just be more comfortable about talking about mental health and to actually involve people talking about mental health?
That's a great question, and it's something that I care a lot about because I think that when people have the courage to reach out and discuss a problem with a professional, they're entitled to have effective evidence-based interventions. So some tips about overcoming stigma on a personal level is to start really understanding and reading about mental health, I think, and start to ask yourself questions about mental health. Like, why is it that I think it's totally okay to go to a doctor or seek help if I have arthritis, but it's not okay if I feel depressed to talk to my doctor or to a mental health professional. So I think it's a bit of a personal journey for some people, and it's very freeing when you can get rid of that stigma. And a lot of the time, I think when you're working with people who are professionals, they can help you destigmatize some of those issues, because I do think that a lot of people, when issues are heavily stigmatized, tend to blame themselves for the problem. So let's take substance use disorders. One of the fundamental or hallmark aspects of having a substance use disorder is that you have impaired control. So I think we tend to judge people and say, well, why do they do that? But the very nature of a substance use disorder is that your decision-making capabilities are kind of hijacked, if you will, by the addiction. So it might seem like a simple choice, but for the person with an addiction, they're very well aware of what they're doing is maybe not a good choice, and they might be ashamed of it, and they might blame themselves and say things like, I'm a loser, I'm a bad person, and other people around them might judge them that way. But in fact, the addiction robs them of their self-control. So I often tell people like that, it's like you have a great car with a wonderful engine. It's really well adapted to reward, which is what helped the human species survive, but your brakes are broken. You have no brakes on that car. So treatment is really going to help you put some brakes on that car. And just when people start to understand, like using the example of addictions, that even though it's not their fault they have an addiction, it is their responsibility to get better. then people can start, once they stop blaming themselves, then they're able to engage in a process of healing.
Yeah.
And so that's the beauty. And, you know, I really encourage people to go just Google stigma, right?
Yeah.
And mental health. And there's all kinds of materials like at CAMH on our own website and Facebook page, or just call us up and say, you know, I'm really embarrassed. I have this problem with whatever it is, and I would really like to talk to a counselor. And I feel a lot of shame about it. And that's the first thing a counselor would do with you, is work on your own self-judgment.
Yeah. Now, I'm hoping that nobody takes this the wrong way, but just listening to you, it reminded me of something in the past, especially. People with mental conditions would be locked up and put in the so-called, let's use the word loony bin. I don't know if it's politically correct, and if it's not, I'll edit it out. And so there was always this negative connotation that somebody would have a mental problem, and it didn't seem like something they really wanted to treat. They just wanted to hide it away. Whereas with health issues, we're more prone to come forward with it because it's obviously something that's going to make people right away feel better. And if you're around people, they'll want to know they're around healthy people as well. Could it be that the history of mental health has maybe contributed to some of the stigma? And if I'm off course, I can leave this whole part out, but I'm just trying to tie that idea together, why it's okay to go to a doctor, but it's not okay to seek professional help or mental health.
I think if you understand the history of any sort of like stigma or racism or anything like that, sexism, ageism.
Origins, yeah.
Yeah, it's almost always based on some kind of ignorance of what the true capacity is of people. And it's always about that that sort of tendency to want to put people in a separate category and say, you don't deserve a piece of the pie, right? Like you're not. So, like, I mean, at one time we used to jail the poor, right?
Mm-hmm.
Yeah. And I mean, we still do in some ways, right? In some countries. So, I do think you're right. Like if you think about Bedlam in England, right? Like the nobility used to come in and pay to observe and torment the mentally ill. And it was like
a form of entertainment.
A form of entertainment. So I think that when we think of people with mental health issues as the other, then we are the ones that have no mental health issues and they are the ones that have mental health issues. So I think if we can start to realize that we all have our mental health, every car has an engine, and the care that we give it. And of course, if you have a Mercedes, you know, it's probably the engine's going to probably last a little longer than your Datsun or your K car, right? So, I mean, some people have vulnerabilities that are genetic, that are environmental, and again, back to those resources and the traumas and, you know, the different things adverse events that people experience in childhood. All these things can make you more vulnerable to mental health issues. And just being a human being makes us vulnerable. We all have mental health that we need to care for and maintain. And that can be challenged by COVID-19 or other events in our lives at different times. So we should all be working all the time to optimize our mental health and care for that precious engine that we have, right? Yeah.
My next point was going to be about the influence of drugs and alcohol on mental health, but we kind of sort of already snuck that in very quickly. And I'm not sure there's anything else anybody might want to add to that, or maybe someone else might want to say something about if they have a question about with drugs or alcohol, why the word I'm looking for is not that the drugs or alcohol would cause the mental health issues, which they can, physical issues possibly, but what is it about a person's mental makeup that wants them to turn to drugs and alcohol as a means of escape or whatever? Does it make any sense?
Are you asking me that?
Well, it was one of the things we wanted to touch on, alcohol or drugs and the influence of that on mental health. But we had already sort of talked a bit about alcohol and drugs. I just wondered, was there anything else we should maybe bring up about that?
Well, I think that the question you just asked, like the thing that when it comes to disorders like gambling, gaming, drugs, alcohol, prescription drugs. There's lots of people that are hooked on prescription drugs, even over-the-counter medications, or even little behaviors like overeating, bulimia, different kinds of compulsive behaviors, hoarding, all those kinds of things. Those behaviors are very difficult for us to understand because they appear to be voluntary, right? So I think sometimes they get classified differently than other mental illnesses and physical illnesses. So just when we're looking at the influence of drugs and alcohol, like again, that vulnerability has to do with the brakes on the person and their particular vulnerabilities. So I might have the genes like to be vulnerable to, let's say, obesity, but I might never become obese because I'm in an environment that doesn't flip that switch on, right? But if I'm in an environment with a lot of stress and a lot of the people surrounding me are overeating and it's easily accessible, et cetera, and I don't learn any other skills for coping with stress, of course, I'm going to turn to what's in my environment to cope, right? And all those kinds of behaviors are very rewarding, right? Because our brains are developed to be rewarded by things that like sugar, sex, all these things that helped us survive, right? And find foods, so high calorie foods in difficult times. So our brains evolved to be very rewarded by these things. And unfortunately, certain drugs, certain behaviors, certain alcohol, can sort of hit that lever in our brain, and our brain doesn't make the distinction between this being something I need to survive and this being something that's going to kill me. So, and if you have a lot of vulnerability, like poor ability to deal with stress, trauma in your life, a particularly stressful time, you're going to be very vulnerable to alcohol and cigarettes and overeating, Doritos and whatever, and those are difficult to overcome, and some more difficult than others because they're also legal, right? So alcohol is legal, and it's very embedded in the culture, and maybe in some cultures more than other, right? Like in some families, drinking is a big thing. In other families, it's not. So there's so much that comes into play. And just one thing about drugs and alcohol, whether they're legal or not, or prescribed or not, is they all have an effect. And when you have mental health issues to begin with, anxiety, depression, maybe you have schizophrenia, or you have other attention deficit disorders, any kind of issue that you might have, alcohol and drugs are not going to help in the long run. They might help in the moment, and all easy solutions help in the moment. The Doritos help in the moment, but in the long run, they're going to cause you some problems. So really, so many of the conditions that plague our society, like alcohol and cigarettes, are some of the top causes of loss of life in the world globally. And they're not necessarily seen as addictions. Like lots of people drink way more than they should, and in a harmful way, without necessarily even having an addiction. But globally, they cause a lot of costs, and they all impact our mental wellness and our ability to communicate, right? If you're a heavy smoker, the only people you're hanging out with are smokers, and you have no idea what the librarian thinks about anything, right? Because you never want to spend any time with her.
Dawn tells me all the time that probably if I'm smoking too much.
But it's true, right? I used to smoke, and when I quit smoking, I discovered a whole new world of what people who don't smoke think about the world, because I never wanted to spend 2 minutes with those people before. Because when you have different habits, you want to be with people who don't make you uncomfortable and make it possible for you to engage in your habit, right? So that's really key to changing any kind of difficult habit, right? Is learning what makes it tick.
And I think that would be like a behavior modification, because I know for myself, I cannot pass a cigarette if I've got a cup of coffee in my hand.
Right.
And as soon as I stop drinking coffee, I don't even fancy the cigarette. So there's obviously connections. Yeah.
That's right.
Sorry.
It must be very difficult for families during this time with the pandemic, being at home, they have to isolate, they have addictions or mental health issues in the family, they have children that maybe have issues as well. These families must have been under tremendous amount of stress. What kind of tools could you suggest to help people with situations like that, where they know they're struggling? And do you have any suggestions?
Yeah, so we've had a lot, and we've also done a lot of collaboration with the different mental health and children's aid societies and school boards, etc. So one thing I want to acknowledge is you're absolutely right, Donna. There's like in homes where there's already a lot of stress, like maybe domestic violence. There's been an uptick all over the world in domestic violence and deaths. But so women or other and men, but mostly we're talking about women as victims, are being so much more at risk than ever before. So in our own particular corner of the world, here in Marathon, one of the things Marjorie House did is made sure they put in, there's been a lot of outreach by the schools, like we're aware of different families, right? So we've been doing outreach calls, and we've also, Marjorie House has put in a text line so that women can text, because if you can't call and you can maybe get off to a little corner in the bathroom, maybe you could text, right? So that's like one situation we're talking about, but there's other situations. So we put up a poster recently with the school board. It's on our website. It's on CFNO. It's about healthy relationships. And it had a whole bunch of numbers there, like if you're not in a healthy relationship, the kids helpline, LGBT helpline, a transgendered youth line, the phone number for Marjorie House and the texting number, Delico, Children's Aid, NOSP, like everything. So we do our best to make sure that we connect with very vulnerable families across the town. So I think sometimes people are not aware from the outside of the degree of collaboration that does happen, and the sort of things we put in place to mitigate dangers, because of course we cannot rectify all the social ills, right? But we try our best to be able to respond and mitigate the risks. And then again, like for the people who are just stressed and worried, there's been so much put out there. And I would really recommend, like, if people are feeling stress in any particular way, like you mentioned, families must be feeling so much stress, and there's so many different ways that they can call us. Like moms can call us, dads can call us, grandparents, whoever. And we're happy to spend maybe 1 or 2 sessions just educating people about the resources that might be available for their particular situation, right? So even troubleshooting with someone on activities that you might be able to do is something we're more than willing to do. It doesn't have to, like, I think sometimes people think, oh, I'm going to go and I'm going to have to empty out my whole life and talk about my childhood and my mom and dad. Well, there's no need to do that. Just tell us what the issue is, and we'll help you with it. You don't have to unload the entire truck. We'll focus on what the issue is, and we'll resource you. And if we're not able to help you, we will guide you in where that information is available to you.
Can I just bring up the next point? Because we seem to go right into it, naturally flowing into it. If I was to walk into your office, for instance, as a patient, what does a mental health practitioner do? And you can be just really, it's not a loaded question. It doesn't have to be really explained. But as let's say, if I were to walk into your office, what could I expect? What would you do? What would your first step be? What actually is the procedure?
Okay. So it's actually very easy to connect with us. And what we do is try and understand what the issue is, like what it is that you're looking, what's distressing you. And so we do what we would call an assessment, right? Trying to understand what's going on. So we're a partnership, right? You're the one that has something in your life that's distressing you or impacting you in some way, and you're seeking some relief. And usually it involves some kind of change on your part, or acceptance on your part, depending on what the issue is. Oftentimes it's like skilling people, giving people the skills they need to face whatever it is that's in front of them, or the resources again, right? So you can really think of counseling as a kind of teaching almost. There's a strong pedagogical aspect to it. And we do have what's called best practices. And we all belong to professional orders that govern the way we work with someone. So we always work within our area of expertise. We always set a goal, like we have an idea that we agree upon, if this is what we're working on. It might change, but this is what we're working on, and we propose a way to work on it with you that makes sense to you. So if I was working with Melissa, I would say to her, I think this is what you're saying you want to work on, and this is how I think we could work on it. And she'll say, sure, that makes sense to me. So it would often involve knowing what we're after, proposing strategies to get what we're after, to achieve what we're after, and measuring outcomes. So we always want to know, if you're coming to meet with me to feel better, am I helping you, right? So is it working? So if it's not working, we're going to sit and think, do we need to change this? Do we need to do something differently? Or do you need something else, right? So if sometimes people need a psychiatrist, or they need to go to residential treatment, they might need some other kind of care. We'll help people link them up to that. Mm-hmm. But generally speaking, that's how we work. It's just determining a goal, working with you where you're at, understanding a little bit about who you are and how you like to work on things, and then we're helping you achieve those changes. The goal of therapy is always to get people to be independent, able to work, to return to their lives with better equipped to deal with issues. Mm-hmm. And people come back, throughout life. Just like you don't sit at the mechanics, right? Like you don't leave your car there all the time. But that every time there's a problem, you can go to the mechanic, and the mechanic doesn't know what to do. He'll refer you to the air conditioning specialist or to the detailer or whatever it is. And we're pretty much the same way. We're governed by rules about confidentiality, that we can lose our license to practice if we don't hold what you say confidential. There's limits to confidentiality, but people need to feel assured that we're professionals and we're governed by professional bodies, and that governs our behavior. Okay. So it's very important that people know that when they reach out to a professional. So that's kind of why psychotherapy became a controlled act, so that you're not giving information to people that don't follow professional rules. Yeah.
Okay. Now I wanted to toss this over maybe to Melissa, just to give her a chance for a second. I want to talk about cost of treatment, consultations, drugs, and OHIP coverage. Was that something maybe Melissa might want to jump in on just for a second?
I can say a little bit about that. So with NOSP, our services, when you come in, they're free. So you don't have to spend like hundreds of dollars on therapists.
They're free as in you need to be have OHIP with you to go in and get free treatment, or it's just free, you walk in and it's free?
I believe it's free. I've never asked anybody for a credit card, a health card, nothing. We're totally free. I believe we're government funded though, eh, Karen? That's where our funding comes from? Yeah. Okay. The only thing that you would probably need OHIP for is if you were to see a psychiatrist through us, if we were to refer to a psychiatrist and they were to prescribe drugs to you, then that would have to be covered biohip or out of your own pocket. However, you're able to cover the cost of the drugs. At NOSP, we don't prescribe any drugs like that ourselves, so we do have to refer out to psychiatry for that.
Okay. Yeah, because I was curious about that. If people were coming in for treatment, and it's probably would be obvious to professionals that they would need some kind of drug intervention there to help them as well with something. But you wouldn't be in that aspect of the treatment then at all.
No, with psychiatry, we do kind of meet as a group, so we would attend the psychiatry appointments with the clients, but we wouldn't really have any hand in prescribing any drugs or anything like that.
Okay. My next thing is point number 8 would be, is age a factor? And the reason I brought that up, we had touched earlier on how a lot of younger people nowadays, and especially our youth, they're constantly on their phones. They're used to communicating. They're used to interacting on the phone. It's like the phone is just an extension of their person, with video chats and everything else that they do. A lot of older people, and I noticed at the beginning of the lockdown, one of the things that I did was I gave my mother an iPad so that we could just get in touch with her. And she's not, because like Karen had mentioned earlier, seeing somebody, seeing their eyes, watching their face gives you a much more impression of how they're feeling, and to be able to react on a different level with people. So I gave my mom the iPad, and funny enough, she picked it up very, very quickly, at least being able to call her on Messenger and chat sites like that. She's not very good at doing it herself yet, but at the very beginning of the crisis, when everybody was in lockdown, it was quite a very, very breath of fresh air where all of her kids could just phone in and say, "How are you doing, Mom?" And we could chat for an hour or so. But with a lot of the older people, most of them don't even have the technology, or they're not either able to, or they just don't want to adapt to that. And they're so used to the social aspect of it in person. So would you say that age would be a factor, especially with seniors in isolation, as there would be more health issues with seniors or fewer, or is it about the same? Is there any difference in age?
I think older people can already, it's a scourge in our society, like loneliness, right? And not just with older people, but maybe they're particularly vulnerable because their mobility sometimes is more challenged than with younger people. So I do think that there's certain kinds of mental health vulnerabilities that different people and groups of people might have. So we know that, with older people, it's really important to maintain socializing for their overall health and especially their mental health. For example, we know when older people become deaf, it's often what ensues with that is cognitive decline, because they're just not having that conversation and that stimulation, right? So it's really important, when you're looking at different groups, to identify what vulnerabilities they might have and to try and mitigate that. And that is something that was done. Like I know in Scriber, the family health care team has a wonderful social worker that did a lot of reach out work and phone calls with other members of her team to people in the community. And they found different ways to reach out. And I think all services that are in the community do different things and take different initiatives to respond to the COVID situation. So if we're looking around the table here at our different roles and positions, I think that one of the things we've experienced as providers of care is that we're doing our regular jobs. We're trying to respond to what we have to do to protect our staff and protect our clients and protect ourselves. And we all have family here, there, and everywhere that we might be worried about. And we don't know what the future is going to bring. So there's been stresses on us as well. And that's something also that we've worked on, is to try and connect with our staff and, just be human, right? And share, I've shared a little bit with my teams, like some of the things that have worried me at different times with family in Montreal. And they've also, talked about either, in a group or alone about different issues that are affecting them. And I think we've been, as an agency, like very accommodating. And I think most agencies have been working really hard to respond to the community and respond to our own needs too. And that's something I really find so remarkable and so eye-opening, because my different jobs in the past, it was more one organization. But here I'm much more connected to a lot of areas and a lot of organizations. And it's really blown me away how amazing the community is with the incredible lack of funding we have across the districts, the incredible spirit of the community and working together with the limited resources we have to respond to people's needs, the ingenuity and the creativity. I could be here all day talking about different initiatives that were taken and the kindness of people. It blows me away. So I think that I'm saying this because I think the members of the community will be very touched to know how much the different organizations in their community really have their backs, maybe in ways they don't know and don't realize. And I think it would be a real comfort for them to know. And we'd certainly we'd like to see more older people, more people that we don't hear from as often, giving us a call. And we're here and we're waiting, and we'd be delighted to hear from them. So, if there's any message I can give people, is really reach out, and take advantage of what's out there for you.
I was just going to add to the comment there, Karen, of being how resourceful we've had to become during this time, and rethink how we do things, how we go about our business. And the anxiety level is tremendous on so many levels, like personally, like you said, work-wise, just environmentally wise. And, we've had to rethink how we're going to function and move through this transition period. And like you said, people have really pulled together in the communities to try and get through this and support each other. And just for an example, the local Scriber Seniors Committee, they were doing call lists. They were going through calling their memberships, doing check-ins. They came up with things like bingo, of all things, to engage the community. And they received a small grant, and they just are now distributing good cheer bags, like 220 bags kind of thing, to reach out to seniors that have a list of emergency contacts and resources. And the library donated a book as well. So we're trying to be really creative and innovative in how we can manage to support one another again and help. The library, for example, we were continually posting emergency numbers on our Facebook and the municipal website as well, so that people know that there are people, there is help available. And even like for us in the library here, it's definitely going to change the way we do business, because it's affecting our programming. We would have a large number of children coming in after school on computers, gaming. We'd have teens come in, and the library is a hub of the community. We would have people of all ages coming through and using our resources. So we're very limited. We have to be very careful in how we move forward, and again be somewhat creative in doing that. But it is creating more opportunities for us as well, with rethinking. For example, we'll be able to do maybe more online virtual story hours. We are promoting our Overdrive access for people to download ebooks. We have our curbside available for people if they still require resources. So I'm wondering what else we could do, though, in terms of helping, engaging people with mental health and helping their well-being. Is there anything that you can think of that other things that we could be looking at as well?
I think that we tend to think of, let's send people to the mental health agency, right? And and we are here, and absolutely we're delighted to get people. And I think that everywhere you go, I really like to think of how can you build the whole community's capacity to enhance people's mental health. So I think every time you build something where people can interact in some way, even if it's not face to face or right up close, right? Because we can have that. Every time you build an opportunity to run a group, do a quilting project, a virtual cooking program, what you're talking about, your reading, your online reading at times, all those different activities that humans center themselves on, right, and come together around, is building our mental health and is healthy for us and enhances our wellness. So on an individual level, like if just thinking about people, like I know I write letters to friends, even though I can email them, I spend time giving nice cards and handwriting it, because I know that when I do that, I'm also telling them, you were worth the time it took to write this letter and post it, right? That's how much I love you, that I'm going to give you a tangible example. I opened a package yesterday from an old friend of mine since we were 16 years old, and she sent me a teapot. And I felt so good, like, because she knows I love tea since we were 16 years old, right? And it just gave me such a good feeling, right? So all these little things and big things that we do as individuals and as communities, any opportunity we have to connect around anything is enhancing mental health in our communities. So I think even just asking people that we come across the question, how are you doing today, right? I think it's stressful. Share a little bit, I'm finding it stressful. I'm in a good period. I'm feeling numb. How about we get together on the lawn this week? Why don't you pop over on Sunday at 3 and we'll social distance while we have a lemonade, right? Or whatever. I think all these opportunities that, are what really enhances people's mental health. I was so happy to see in Marathon that the city is putting on a summer camp for kids. And I know our counselors, our children's counselors, are trying to insert themselves there to do some yoga with the kids. So sometimes, like there's many, what do they say? There's many roads to Rome, or there's many ways to skin a cat or whatever. And I really think of mental health should be sort of everywhere you go, like a nice exchange with your mechanic or with your hairdresser enhances our mental health.
Yeah, anything that's going to connect us to others, yeah.
Anything.
So we can go right to the next point, and that was, we've already again touched on some of it, and I think having a library as a community hub where people can interact when they could and hopefully can again does bring something for mental health. But how do we stay positive? And especially in these times right now where everybody was thinking that within, it was 2 weeks and it was a month, 3 weeks, we're all hoping to see the end of COVID at some point. But in the back of our heads, we all know there's a stage 2 lurking about. There's a possibility of just an uptick like they're having in America right now while they're still in stage 1. How can we, any little secrets, ideas that we can stay positive even though when we know coming up might be bad news or things we've got to deal with?
That's an amazing question. I'd love to hear Melissa answer that one.
That would be a good idea, yeah.
A good one that I have seemed to have found with a lot of the parents that I talk with is staying on some kind of schedule, even if you don't really have anything to do that day, because they don't have school. Some parents don't have to go to work, but still scheduling your day has been really helpful. It gives a level of certainty to the kids as well as the adults. You know what each day is pretty much going to look like. So that's helped a lot. I think the other thing is just doing things that you can look forward to in a day. I've worked with kids and we've even talked about things just as simple as like getting some sidewalk chalk or you know, going outside and making up little scavenger hunts just so that you can have something to look forward to each day. And it could even be like the kids' favorite lunch or like a family picnic, like in the backyard. Just having like those things where you can still be excited and you can kind of leave the worry of COVID behind for a little while. And I mean, even for families right now, it's a good opportunity to like connect with each other. Some parents aren't able to go to work right now. Kids aren't able to go to school right now. It's summertime anyway, but it's a good opportunity to do more family activities and like reconnect in a way that you haven't had the opportunity to before.
Yeah, so structure and then also the idea of reward for that as well. I was speaking to somebody this morning actually, and they said the same thing. At first they were going a bit stir crazy because they didn't know what to do with themselves. And all of a sudden they're finding all these projects to do, whether it's fixing their house, picking up an instrument. You just have time now because that other distraction of your normal everyday life that we get into, that whole routine, seems to have gone away, and you can create a new routine or a new structure, and it can be quite eye-opening. Yeah. I'm looking at my time here, and we've just about gone through an hour already. It's been really quick. We talked about self-worth, acceptance, social outcasts, and youth. Has anybody got anything else to say at this point before we sort of head for a wrap-up?
Rona.
Yeah.
Listening, I have found myself thinking about what I do, and I'm actually being in contact with elderly family members a lot more than I used to. Like once a week, there's a phone call, there's FaceTime, there's whatever means I have of getting in touch with them. And I'm really enjoying it. I've got she'll be 96 years old next month.
Wow.
She is so on the ball, it's not even funny, that woman. Yeah, and I've got an 85-year-old cousin who has dementia, but we still talk. She has dementia. You know, that's not wonderful, but we keep in touch. And I find that's important, not only for her, but for me, because I want to see how she's doing. I've got another relative who is experiencing mental health issues, but they came before COVID. It's an ongoing thing. And that one's kind of tough because I spent nearly 3 months there starting last November. Oh, and when I came home, I was burnt out. Okay. Because it wasn't fun. I would be back with her now, except that I can't get there because I can't travel there.
Can't go anywhere. Yeah.
Yeah. And you know, when I'm of two minds on that, I'm glad I can't travel there because I don't want to feel that way again. But I also feel bad because I can't be there to be with her. You know, I'm torn.
Yeah.
So I guess if I can ever travel back down that way again, I'll probably end up going. Just to satisfy myself that she's doing better. Although I can judge how she's doing by her voice on the phone. Yeah.
But at least you're contacting her and you're keeping that communication going, and it's something to look forward to, I think, on your part and her part.
Well, she's actually phoned me a few times, which is good. That's a really positive sign. Before that, she wasn't.
Yeah.
So, you know, I don't know. I'm an introvert. I don't need a lot of people around me. But I do have one friend who I've been really happy to avoid because it's between 2.5 and 3 hour phone calls daily. And sometimes twice a day. And that can get to be a bit much. But I have to give in and do them because she's on her own.
Yeah.
No family locally. I know I don't have COVID-19.
Stop smoking.
I stopped smoking 18 years ago. That's the result of having smoked for 40 years.
I guess, Karen, I would like to, because we're definitely hitting the hour now, and I didn't want to keep you guys so long, but we've been getting some really great information from you, and I really appreciate it. But is there some way we could maybe wrap it up, summarize? What would your words of wisdom be for us? And because the next part that I obviously had was about staying positive, but our issues with self-worth and acceptance and being kind to each other. Yeah, I'm just looking for some kind of a little summary from you. I think that would tie us all up here.
So I think I can. I think that if we go back to the beginning, we talked about mental health being a really broad range of things. So it's difficult to cover everything in an hour and a half. But I think that in the context of COVID-19, we really pretty much covered vulnerability and signs that you might need to reach out for help, and different ways of coping, and the sheer volume of resources that are out there for different levels of need. So I think if anyone, listening today was going to take anything away, is that it's okay not to do COVID-19 well. Like some of us are not learning the violin or learning to speak Mandarin, and that's okay. If you're just getting by, that's okay too. And that is it, like Melissa said, it's really important to, and I think Rona said it too, it's important to build pleasure into your life every day, to resource yourself, your spirit and your mind and your heart and your body, and that we are a service that you fund. Our service belongs to you, and we are here for you. So like Rona, if you need some strategies to put some limits on your friend 3-hour calls, give us a call. We can work with you and teach you some ways to set some boundaries around that.
Oh, I figured that one out. I just say goodbye.
There you go. And if your friend, needs some resources to expand her repertoire, let her know. She can call us, right? So I just want people to know that we belong to them and that we're happy to help them in, with what they want to work on. So we are oriented towards working on something that's really important. But even if people just want to shoot the breeze, we'll help them find a place to do that, right? So I really want to encourage people to walk away with the idea that we belong to you and we're here for you, and we can, don't be afraid of us. We won't make you do anything you don't want to do.
Melissa, anything to add before we go? I don't mean to put you on the spot, but
No, that's okay. No, I think Karen really touched on it very well. I always go into it letting my clients know that, like, this is a service for you. It's directed by you. So we'll work on what you want to work on. And if we start going in a direction that you're not comfortable with, we don't have to go there. Like, it's totally client-centered, and it's not as scary as people think. It's very directed by the client. We're not going to make anybody do anything or talk about anything that they don't want to.
That's good to know. Donna, any last comments before we say bye?
Well, definitely mental health is a state of well-being. That body-mind connection is so very important. It is important to look after ourselves and nurture ourselves and surround us with as many positive people as we can, and to be open and to listen. I think sometimes that we forget to do that. That's important. And like you said, Karen, just to smile and say hello. Sometimes little things like that can really pick up someone's day. And we will continue to be resourceful and innovative and try and connect as much as possible. And I think we'll all weather through this. It's going to be very interesting to see what tomorrow brings.
And if we could let people know that psychologists are not scary people. I saw one years ago because of something that I was going to do, and that was fine.
Yeah.
Not a problem.
You're here with us today.
Hey?
And you're here with us today, so there you go.
Still here.
I want to make your engine run better. That's it. That's all we want to do. And we do what you want us to do. So I think you're right, Rona, that sometimes people have this image that they're going to have to lie on the couch and talk about their whole childhood, and that's just not the case. And oftentimes it's really just about helping people just be a little bit more agile and adapt. Like just like learning to play tennis is a skill, so is learning to talk to other people, get what you want, set boundaries, speak up for yourself, get that career you're looking for, become a better parent, whatever it is, a better friend, whatever it might be. We're here for you, and we work on what you want to work on.
Great.
Yeah, the worst part of it for me was the 40-page booklet that I had to fill in.
Oh. We won't make
and it was a repetition of the questions right through, and I got onto that really quickly.
Well, I think we've taken over an hour and a half now of your time. I can't believe it. But I just want to thank you both, Karen and Melissa, for joining us, for being part of this whole panel, and for Donna, Rona, that could join us so we could have this talk. I think it's very important that people learn that it's okay to admit when we have problems with our mental health, and that they should seek help for it. And I think hopefully this discussion is going to help people when they look out and see it. So again, thank you very, very much for participating this afternoon.
Thank you for having us.
Yeah, thanks for inviting us.
Thank you. And Karen, you're awesome.
Oh, thank you. It's a pleasure meeting you.
Okay, guys. Thanks very much.
Okay. Thanks,
Bye-bye.
Kim.
Ciao.
Bye.
Bye.